things you would be doing for your patients centers around this ADLS. You'll have to, as a healthcare assistant, you communicate, you'd help with the activities of daily living. And we all know how this particular aspect is very important to our jobs as a certified healthcare assistants or health workers generally. So just imagine, I want us to just look at this. I always like us to visualize certain things. Just imagine you waking up. Imagine you may be sleeping and waking up in a very cozy room with sunlight streaming through the window. You are just relaxed on a very, very fine day. And you stretch, feeling the warmth of a new day ahead. Oh, you wake up in the morning, a new day lies ahead of you. As you slide out of your bed, you realize that you need help with some simple task. Getting dressed, perhaps, maybe preparing breakfast, or even taking a shower. You realize that you can't do these things, that you would need help doing these things. Now, for many people, these everyday activities that we do can become significantly challenging for some of us, not for everybody. It could be due to age. Maybe you are aging, and as such, some of these things, you can't really do them easily. It could be as a result of illness or disability. Maybe you have disability one way or the other. So it could affect your ability to carry out these activities for yourself, these activities of daily living. So as a healthcare assistant, you play a crucial role in helping these people that actually need your help navigate the routines with dignity and respect. Very important. If you cast your minds back, you would remember when I kept telling you that we would get to ADLS, activities of daily living. And today, thank God, it's the first module. So as I was saying, this is very, very important. It's a very crucial part of our duties as a healthcare assistant. You understand? So for many people, like I said, different things can affect them. As such, they are not able to do these things. So that is where you come into play. That is the crucial role that you'll be playing in helping these people navigate these routines with dignity and respect. So today, practically under this assisting with activities of daily living, we are going to be talking about how best you can render this help to these people, how best you can be of help to them because they really need you. And in the course of you carrying out these duties, you must ensure that you do it with dignity, you do it with respect. It is very, very important. Because like you and I, even on this platform, let's take, for instance, maybe Kate, Paul. There are things you do for yourself. Personally, you do for yourself. You like to brush your teeth, the way you like to do it. You like to maybe use the toileting. You like to move about the way you like to do it. You understand? So if it's really going to affect you, then you would want to do it very well because they are personal to you. They are important to you. They are things that has got to do with your person. So you make sure that you do it properly. So when you are attending to someone else, because this person already is psychologically affected, knowing fully well that he or she is not able to navigate all these things, to do all these things for himself or herself. So it's already demoralizing in the first instance. So you helping a person do that, you must ensure that you do it with all level of respect, all level of dignity, ensuring that you don't further dampen the person's self-esteem. So today we want to look at, like I said already, we are going to be looking at activities of daily living, ADLS. And what do we mean by ADLS? Please pay attention, because when in professional examinations, even when you have to actually work, these are questions. Most of the questions come from ADLS, most of them, even the ones you are practically going to be answering maybe for during interviews for employment, they ask you how best you can handle these things. So today, we want to look at these activities. What does it mean? What does ADLS mean? Activities of daily living, like I already said. Those basic care tasks that you perform daily for yourself. Brushing your teeth, dressing, of course, put on our clothes every day. Of course, we brush our teeth every day. And we take our bath every day. We go to the toilet for toileting. So these are activities of daily living. Now, assisting with these activities is very, very important to help maintain independence. To help maintain independence and quality of life for all right, so now this ADLS can be divided into two. We have the basic activities of daily living, that is BADLS, activities of daily living. And we have the instrumental activities of daily living. Okay, all right, so Dami, I can see your hand is raised. Any challenge?
It's a mistake, ma. Sorry, ma.
Okay, all right, thank you. All right, so we have the ADLS divided into two. One is the basic activities of daily living and the instrumental activities of daily living, IADLS. They are two different ones. So we have to understand the difference between the two. All right. So now, having seen that, let's move to our slide number 2, the next slide. Now, on this slide is a picture of those activities. It's just grouped into 5. There are other ones that we would see as we progress. There are other ones. So, but for now, you can see there bathing. That's an activity of daily living. You can see the dressing, the transferring. That's to say, you'll have to do all those things. There are cases where you'll have to dress your patient or your clients, as the case may be. You have to dress your patients, and you need to know you need to have the skills at your fingertips. How are you going to go about doing these things? Very important. Now, there are times too, you may need to transfer your patients. Your patients needs to be transferred, maybe from the wheelchair up to the bed, or from the bed to the wheelchair. Transfers are very important. So you need to know how to navigate these things. Very, very important. Then we have the continence too. We have the continence and we have the incontinence. They are two different things. The continence, someone being able to handle his or her urinary parts. That's the part of her body. That's the urinary system. You are able to control urine. You want to ease yourself, you get the signal, it sends the signal to you, oh, I am pressed, I need to use that as continence. Then incontinence too, we have issues of incontinence. So you may have maybe a patient that actually has incontinence challenge. And what is this incontinence? Not being able to not being able to control urine. Sometimes you see some people, maybe when they cough excessively, or maybe they exert pressure. So that pressure makes them, sometimes they let out urine unconsciously. It just comes out because of the pressure. They are not able to control, which is a challenge that most people have, most patients may have in the hospital, that you need to attend to. Also, meal preparation, all those things are put together, are things that we would be doing. Normally, like we talked about, the two groups of activities of daily living, which is the basic ADLS. It could also ADLS. Then we have the instrumental activities of daily living as well. Now, how you'll be able to know the difference at a glance is that the ones that are the basic ADLS are those things that you get to do every day. are those things that are more personal, that you get to do on your body, that you get to do around your body, around yourself. Those ones are the ADLS. Then we have the instrumental activities of daily living, which is the IADLS. That one is more complex, maybe shopping, managing finances, medications, housekeeping, laundry. Those ones have not got to do with your personal effects. So we term them under instrumental activities of daily living. All right, please, are we together? Can everybody hear me clearly? Because this particular module is very important. Then I'd like to ask too, we had one or two people with challenges. I don't know if they are here. Please, Helen. Helen, are you here? Wow. Hello, Helen. Okay, maybe she's still
here. It's breaking, ma.
Helen, can you hear me? Okay, maybe she'll join us later. Someone is saying it's breaking. Please, is it breaking? Because I can hear myself clearly. I don't know. Can everybody hear me loud and clear?
Yes, we're hearing you now, but it's breaking.
Okay. All right. Now, we were talking about the BADLS, activities of daily living, or the physical one. So which one? All right, so sorry for that. We were about saying, I don't know why the network is. I just pray that network favors us to deal, because we wouldn't be able to. So there are a lot of things under basic activities of daily living, a whole lot that you need to do as a certified healthcare assistant. That's what we are going to look at now. Take note, everything is not embedded in the slides. If I want to do all the talking, put it together in the slides, and wow, it's going to be a whole lot. So we have to try to hear ourselves. At any point, please, that you are not hearing me, please indicate in the chat box. That's why we have the chat box there. You may not need to interrupt me, but I am looking at the chat box from time to time, like I like to do, so I can know when anyone is not with me. Whatever comments you have, please drop it there. I've just seen someone drop a comment here. Good evening. Okay, that's okay. So let's move. All right. So we have the bathing. Bathing is one very important activity of daily living, taking a full body bath or a bed bath. Most of the things we are going to be hearing here on this ADLS and how it is actually done. Like I told you when we started, that we are going to have the practical sessions. And trust me, we do justice to the practicals. You will see these things, how it is done firsthand, and you can ask any question. But it is important that we take the theoretical aspect so that you can have a reference point when you are reading, and you can also hear my voice, because the practicals, sometimes, most likely, it may not be me you'd see, So for those of you that are used to my voice, you hear me as I am doing the theoretical aspects of the program. So like the bathing, most times you may need to bath your clients, It may not be the full bath, depending on how your patient is. I can say patients or clients, please, it means one and the same thing. So if it is the one that is bedridden, that cannot actually move to the bathroom to bath, or you to assist in the bathroom, we do what we call bed bath. We clean up that person. We bath the person on the bed, that is one of the skills of a CHCA that you are going to learn. You see how to give a patient bed bath properly, how to clean all the areas to avoid spread of infection, how to do it right. We'll get there. We'll see it when we get to the practicals. So another is bed mobility, moving and turning. That's another very important thing. Moving and turning your clients or your patients because of bed sores. If you keep a person lying for too long in a particular position, what happens is the person has, especially a person that is bed bound, the person begins to have bed sores. So the body begins to peel. So it is important that you know. I remember some years ago, when I was attending to my grandmother, some years ago, then so many years ago, then I had no idea of health. I didn't even understand. And because we used to leave her, my parents were working, and occasionally we go to see her. So the person we actually hired to take care of her did not do her job properly. So she would just abandon the old woman, and the lady will just be there, because she cannot turn. She's bed bound, fixed to one position. She cannot even turn her body, except you assist her to do that. So over time, we now observe that her body now started peeling off her. That is what I mean by bed sores. Her body now started peeling off her. When you want to, maybe you cover her, the covering of the bedsheet that she lies, by the time you want to turn her, you see that her body is at, I don't know how to put it, but her body gets intertwined with the clothes. So those are some of the things that a CHCA has to do when you have such a patient, especially you are a geriatric CHCA, that's you work with the elderly people. Turning them, you have to be doing that intermittently after some hours, so that they can fresh air, especially in their pressure points that we are going to learn. We are going to learn and touch it, practicalize the different pressure points in our bodies. So if there is pressure on a pressure point, it results to bed sores. So this is what happens. So as a CHCA, is one of your duty, for bed mobility, turning your clients, moving from one position, from one side to the other on the bed. We also have the body care. We are still talking about basic ADLS now. We also have the body care. How do you take care of the body of your clients? How? Now, there is one thing I want us to understand. I know I said it the other time, but for the purpose of one or two persons that have joined us today, I just want to recap it. For every patient, there's what they call a care plan. In a hospital or in a care home, there's what they call a care plan. It is on that care plan that the duties that you are going to be rendering to that patient is clearly spelled. It is on that care plan that you'll be told that patient has maybe diabetes or has maybe Alzheimer's disease or has dementia or whatever. You get to know the state of the patients that you are handling. Now, the care plan is tailored to meet the needs of individual patients. My care plan is different from another person's, would be different from another person's care plan because, of course, our illnesses and our ailments are different. So in that case, we cannot have the same assistance. And there are different levels of assistance that you can assist. There are people that on their own can do a lot of things for themselves. They just need that little assistance. They can actually maybe move and walk, but they will just need you to assist them or an assistive device, but they can still use their leg. Then there are the ones that cannot even move. Movement is zero. They cannot move for any reason. They are bed bound on the bed. You understand? So we have different ways that we can ask different level of assistance as is contained in the care plan. Okay. So that's what we should understand. So some of these activities of daily living, the way we do them will vary depending on the illness of our patient, depending on the level of assistance that we can render to our patients. Now, we also have others. We have the dressing too. We have the eating. You'll assist in eating. We have locomotion in the room. Locomotion, that's movement between locations in a room, in that immediate environment, movement between one location to another in that immediate environment. It can involve maybe walking or using a wheelchair or just movement. That's actually called ambulation, because you may be asked, what is ambulation? And you need to know it as a healthcare. So movement between that environment from one location to another is called ambulation or ambulating, just as you have seen it there. Okay. So we also have medication management as well. It is also your duty to help with managing medication. So remember that we had talked about those things that are personal to you, that you do to your body, that you do for yourself, that you do to get, on it. So at a point, I'm going to ask you some questions. So that's why it's important that we listen. If you listen to me, even without looking at the slides, you listen to me, you'll give me the correct answers to the questions when we eventually get there. So we also have meal preparation too, ordinary house chores. Those ones fall under another category of ADLS, which is the instrumental activities of daily living. Those activities that are instrumental to making us, to building us physically. Those things that we actually do that are instrumental to helping us to function effectively. That is why it is called IADLS. It involves more complex activities, maybe like managing finances, medication management, food preparation. Of course, it gets there. As a health CHCA, especially if you are not attached to somebody in a hospital situation, you may be sent as a certified healthcare assistant attached to a patient, depending on where you work, to attend to the patient. So you are like more or less a household CHCA. That's, you are attached to that particular patient to take care of the patient in a residential facility, maybe in the patient's residence. So your duties can extend to you shopping, can extend to you preparing food, preparation of food, can extend to you keeping the house. And in most cases, not in all cases, you may even be involved in helping the patient or your clients to manage finances. So all those other ones that has not got to do with brushing the teeth, toileting, transferring, and doing all those, they're all classified under IADLS. That's instrumental activities of daily living. Please, are we together? Is that clear enough?
Yes,
yes, it is.
Okay. All right. Like I like to say, when I ask for response, yeah, I like everybody to respond so that I can be happy. Because if only Modupe responds and only Kate responds and maybe Madam Abidemi responds, I'll just feel I'm talking to the three of them. So at the end of the day, it's not going to be, it won't make me happy. So I need to be happy today. So please, when I ask for response, please, let's try to respond. Thank you so much. I appreciate everyone. So let's move to the next slide. If we are okay by that, let me proceed. As you can see here, I just tried to get some pictures so you can really actually see. To be a caregiver, to be a CHCA, like I said, to be a CNA or any of those health-related health duties that we do is not easy. It's not a walk in the park. So it is important for us to learn everything we can learn in the way we can learn and as soon as we can learn it, because it's like you telling someone, maybe a lady that is about to marry and you are already married, you're trying to advise her. You say, marriage, when you get into your marriage, do like this with your husband, do like this with your wife, you try to give that advice to them or to them. But the fact is that, yes, they can leverage on some of those things you have told them. But those of us on this platform that are married, and even those that maybe have relationships, you'll understand that it is totally a different ball game when you step feet in there. And why am I saying a different ball game? Because your own scenario may be just different from mine. That's just it. It may be that my own husband likes what I cook this way. Your own husband may not like it in that way that I advise you to cook for him. So we have to just ensure that we learn everything we can learn, because it will come in handy depending on the situation or depending on the particular place of work that we find ourselves. Hence, it is important for us to learn. So like you can see some of these things here. You can see that CHCA, your job can even extend to you taking your patients out, maybe for shopping, maybe to have a haircut, maybe to do something. Sometimes, like I said, depends on the level of assistance that is contained in the care plan and in your own service plan as a CHCA and working in that particular facility. So these are some of the things. You can see dressing there. You can see at that point, You can see how that elderly lady is being dressed. So all these things are things that we really need to understand so that we'll know how to go about it. Now, on this particular slide, we are looking at personal hygiene. We had already talked about infection control and prevention last week. And I took my time to explain that hand washing is very, very important. In fact, let's put using hand sanitizers aside. Let's talk about hand washing. Hand sanitizer is secondary, but hand washing is the primary way that you can infection control measure. That is hand washing. So it's, as a CHC, at any point in time, never be tired. Don't be tired of washing your hands. Don't be tired. We cannot overemphasize the importance of hand washing because everything you do with your hands. So your hands has to be clean so that you don't spread infection. So now we are looking at personal hygiene. Maintaining hygiene prevents infection and promotes well-being. That we already talked about. So when we are assisting your patients with bathing, there are things you need to know. Very important. There are things that you need to know. Bathing. One, privacy is important. Privacy is very, very important when you are taking care of your client. Even if it is in a maybe a care home, a care facility, or in the hospital, whatever you are doing, ensure that you give your clients privacy when it comes to bathing. Even if you are doing a bed bath, you see the way we will be doing the practicals. Even when you are giving a bed bath, you have to make use of the curtain, make use of the screen. Hospitals have that, even in care homes. The screen, you make use of the screen. Make sure you cover the patient at all times. They have the right to privacy. That is why it is called rights, because if for any reason, any part of their body goes off, now in this our internet world, technology, so you wouldn't even know. Anybody snaps it and then puts it on internet, or you you disclose certain aspects of the agreement, they have the right to privacy. So take note of that. So even as you give the bed bath, you will not have to, when we do the practicals, you understand, you will not have to pull out all the whole clothes of the person. No, you maintain privacy, you cover, you only expose the part that you are cleaning at every point in time. That is how it goes. In the hospital setting too, you do the same. Your client has, or your patient has, the right to privacy. And most importantly, when we talk about ADLS, is you are ensuring that you take into consideration the preference of your patients. Now, over the years and over and over, when I keep taking these courses, this question has always popped up. People have, one or two students along the line have asked this question as regards taking care of your clients, maybe trying to ensure that you incorporate your clients' preferences into anything you do. Some of them said, if I have this patient and the patient wants to use this particular product or something that is detrimental to him or her, what do I do? They always say that because, sometimes if you have a patient that is difficult, yes, that is challenging, let me use that word, and always poses up with challenges you. Maybe you need to do like this, and he's like, no, I'm not ready for this to be done, or I don't want this, I need this. There are times you even have patients that want to eat what they want to eat, regardless of the fact that it is detrimental to their health, and you are there attached to them, and your priority should be of the patient's well-being. They have asked these questions severally. And I keep telling them something, that when you work with vulnerable people as a caregiver, as a certified healthcare assistant, you're a caregiver, like I said. So if I say caregiver, know that I am referring to you. Now, the most important thing is for you to take into consideration the preference of your client. Take, for instance, a person that has diabetes, maybe is diabetic, wants to take something sweet. They are humans after all. So when you say don't take sugar, don't take this, your insulin level, and so on and so forth, you say a lot of these things. They are humans after all, and they may want to, excuse me, they may want to feel, the taste. They want to feel something sweet. They may want chocolates. They may want, something like that. So that is what they prefer. It is never right for you to superimpose what you want on a patient. That's what I want us to understand. Here in Nigeria, anything happens, anything goes. Like I like to say, anything goes in Nigeria. But most times, when you go across the world to most of these countries, they have stringent measures and they don't take things lightly the way we do this way. So you have to ensure that so you don't get on the other side of the law. One of the things you shouldn't do is to superimpose whatever you want on the patient. Or, okay, the patient is vulnerable, so you go all out to do things for this patient without taking into cognizance the things that the patient himself or herself can actually try to do on their own. This is very important because it may come out in the exams when they are actually giving you the proficiency tests. These questions will come out. So it's important we pay attention. So if you have a situation whereby you are in a dilemma, that's a dilemma where you want to do everything possible to ensure your client is getting better, and your client on the other hand wants to be happy, wants to take this, what he or she feels like doing, you are in a dilemma. So what you do in such situations is you report to the members of the health team. That's why the healthcare team work together. They work pari passu. So it just goes around. Whatever challenge you have, relate it to your supervisor, relate it maybe to the nurse, to the doctors, let them know what you are actually experiencing. That is after you must have tried to explain to your patients, let your patients see the need for him or her not to toe that route, not to use that, not to go that way. Let him or her understand that it's detrimental to your health. And I have your interest at heart. It will not be advisable for you to take this particular thing or for you to take sugar because your sugar level shouldn't go high. Appeal to them and talk to them, but do not force. Oh, you are a patient, like I've seen severally done in Nigeria. You are in hospitals. You are a patient. The doctor said you shouldn't take this. No, you cannot take it. Some you collect it from them or you treat them anyhow because they are vulnerable. Please, that way. So whenever we are doing anything, we should take into consideration what our patients or our clients in this case actually wants before we go ahead. If in terms of having a bath, some of them may prefer to have a shower. Perhaps it's for some time they've not actually had a shower, so they may prefer to have a shower, or some may prefer to have just a sponge bath. So their preference is very important. You know why? Because if you take away their preferences from them, in their vulnerable states, you are killing their self-esteem. You are dehumanizing them. You are making them to feel less of humans. You understand? So that will not be good. Already, when a person is down, when a person is going through one illness or the other in such states, they are very sensitive. And any little thing that they misconstrue from you can affect their health. So as you are going about it, remember we talked about communication. Do take note that you have to give them that preference. You have to make sure they are dignified. Whatever you do, consider dignity, put dignity into the picture so that at the end of the day, you can be happy and you can achieve your goal of being there. Very important. All right. So I'll need to ask based on that, because like I said, I have had questions on this particular model over time. So do we have any question? Does anyone have any question, or should I proceed? I don't like to talk. The place is too quiet. I like to hear your voices. So do we have any question or any contribution? Have you had any situation where you have tried to do something for a patient or for a client? In this case, if you are not already a CHCA, maybe for your mother or for your in-law or for your neighbor or someone, doing something that you feel that will be good for the person's health, will help the person health-wise, and the person is like trying to align towards something that's is detrimental to him or her. Please, do we have anybody?
Yes, ma'am. This is Dorothy.
Okay.
Yeah, good evening, house. My name is Omowumi Adesoya.
Omowumi Adesoya. Okay, Omowumi, have I heard your voice at all since I started this training since last week? I don't know, because I've heard many voices. I'm not sure I've heard this voice. It's a beautiful one. Go ahead, please.
Thank you.
Yes, it's my mother-in-law that I want to bring in.
Okay.
She
Share
has
with us.
diabetes and she's hypertensive too.
Wow.
So we got her one caring there's a caring home
Okay.
in Ikorodu there. So the lady always send different different care help to come and take care of her. So she
Okay.
always there's something they call taba. So whenever she take that taba, she goes high. And she said on her
That's
own,
sad.
she said that gives her energy, that gives her strength to be able to stand up because she couldn't
Yeah.
stand up
Yeah.
later, she couldn't do
Okay.
anything. So
Okay.
we now told her care health that anybody should not buy that thing for her. Then
Wow.
suddenly she did as if she cannot hear, she cannot talk because we didn't allow her to buy that taba. So when I now heard, I said, hey, this now, wow, which kind of wahala be this again? So we now called her. So I said, no, there's nothing wrong with her. It's not because of the taba. So then the care home changed the care health girl. So the care health girl did not know that we didn't allow that taba. So when we now ask the girl that, why did you go and buy this thing? Why didn't you call us before going to buy it? She now said, mommy nearly killed herself, that she was really begging mommy that this thing is not good for her health. This thing, that, but she doesn't have a choice that to go and buy it. So when we are talking about let them understand why they can't take what they shouldn't take, that's when I remember this situation that so this lady, this care health girl now that went to buy it because of how mommy was behaving, what would they do to her if they later hear that she bought what she's not meant to take? Because this our mother, they will stress you that no out, and there's some patients like that you have to do this thing, and it's not good for their health.
Yeah,
so
thank you so much. Okay, yes. Now when we talk about there's a difference between doing a caregiving job professionally and doing the family caregiving. Now, in this case and in this situation, what you are saying from your own end, you said that's your mother-in-law or so, I presume you said. Now, you are a family caregiver. In the real setting of the work that we do as CHCAs, as caregivers, it is there, the legal aspect of it covers what I am telling you. You cannot, for any reason, force whatever you want on a patient. In that scenario where your mother-in-law was having those issues, communication is very important. We talked about communication last week. Believe you me, there is no way you will tell me that your mother-in-law does not have at least one person that can break into her. There's no way you will say that. What do I mean by breaking into her? Let's forget about the health team now. Let's talk about the immediate home, immediate environment and immediate home now. Maybe her daughter or her children, everybody around her. I know how these old people work. I have them. They are the ones that are very dear to them. That even if they say they don't want to do that thing, just a mere hearing from that particular person will break that resolve that they already have. That's one. If it is the home one, like you are the sister, daughter-in-law, it's easier for you to say, okay, take, don't take, and all those kind of things. But if you are actually a paid CHCA working in the hospital or working maybe in a care home, a care facility, or you are being paid, you are a professional caregiver, as in professional certified healthcare assistant, go in such a situation, that's where I say you cannot work on your own. That's caregiver. I don't know which kind of, I don't know if she comes from an institution or whatever. You said it's a care home. She cannot on her own function and say, okay, let me go and buy that drugs and come and give mama. No, even though what she should do, because that is a challenge, that is a dilemma. She's in a fix now. This is what mama should not take. But because mama is not taking this, see the things that is happening to her, or these are the signs and symptoms she's exhibiting. Then it is the place of the caregiver to report to the higher authority in that particular facility. whereby there will be at least 1 or 2 or 3 people. Now, let me tell you another thing. There may be another thing that mama can take that will not have such effects on her, that will not be detrimental to her health, and will also solve that challenge, or will also give her those things, she'll also gain the same result that she gains from taking that. Let me give you an example. Sometimes we have those people, they may say, I like to take, maybe I like to take coffee, for instance, and mama likes to take coffee. Let me use an example. And since mama likes to take coffee, the doctors have said that coffee is not good for mama to take. But mama insists that she wants that coffee. What you can do is this. There is a reason why mama likes coffee. There is a reason. Maybe she likes the coffee because of the taste. Maybe she likes the coffee because of the flavor. It could be one reason or the other. Now, if the care team will sit together and deliberate and say, this mama likes coffee. Let's try to find out, mama, why do you like coffee? Why do you like? She will tell you, maybe if I take coffee, I feel better, like that thing you have said. When mama takes it, she's able to maybe move about. She's agile, like it gives her a kind of strength. If you sit with mama and discuss, there could be other medicines or medications that mama could take that could serve the same purpose, but will not be detrimental to mama's health. But you as a CHCA, you will not be able to solve that alone. That is why you have to work with the total healthcare team. Alone by herself, that particular carer or that particular lady did not do well because she was not supposed to go on her own to go and purchase the medication for mama without consulting other members of the care team, because a person, only a caregiver or a CHCA cannot work alone by yourself or by himself or herself alone without aligning with the other people that are involved in taking care of mama, maybe the doctors, the nurses, all the members of the care team. So she didn't do well by doing that. At the same time, if she had consulted the people that mattered, everyone would have put heads together to see what else they can give mama that will make mama agile, that will make her to have all those benefits, those results that she really wants, that would not be detrimental to her health. So that being said, Omowumi, I don't know if I've done justice to that your illustration. Are you still there? Hello? I just hope network is not trying to make me talk to myself. Can everybody hear me? Are we together?
Yes, ma'am.
Yes, ma'am. Yes, ma'am.
Okay. The thing is, I couldn't hear. Omowumi, did you hear me? Are you okay by that? Maybe she's off us. Okay. So practically, that is what is important. I have stressed it and I'm stressing it because BCC UK, we try to ensure that the people that pass through us, we go out of the curriculum, we go out of the course outline sometimes because we have heard a lot and we have seen so many things, you know, based on our partnership with them, we've seen a whole lot. So we try to ensure that we explore all the avenues that we can. So for reasons that we shouldn't, like for based on what I have said, most times it is tempting. Like I always say, it is a very high level of temptation when you are working with these vulnerable people, you know, because you are torn between pleasing them and actually carrying out what is best for them. Those two things most times used to go at different directions. You find out that especially our elderly people, the ones that are actually old, maybe having dementia or having one challenge or the other, you see they are always wanting things and doing things that go in the opposite direction from what will actually lead to them recuperating or getting better. Is always going the opposite. So that's where we have caregivers dilemma. You as a CHCA, you actually have such situations, and it's best for you to understand that you cannot tackle such situations by yourself, and you cannot enforce anything because you are not supposed to. Let me say, so you're not supposed to enforce anything you want on these people. Take advantage of the fact that they are vulnerable. Maybe they are ill, they cannot move, or they have this, and you just feel that no, you can just go ahead and treat them anyhow you like. It doesn't always end well. So that being said, let's proceed to mobility assistance. This is another ADLS that is very important that we need to know. mobility assistance. What is mobility? Movement. Simply means movement. Anything that has got to do with movement. And as a CHCA, you do a lot of this. You may want to, make your patient happy. Maybe she's laid down for a long time and she just needs to take a walk around the facility, ambulation, moving from one place to another. You do this, you have to help. That's why you are there. You have to help. And how can you help? Like we said, as much as possible, I said last week, encourage the patients to do what he or she can do to the best of his or her ability. Do not be tempted at any point to do, okay, this person is not fine. Oh, let me do this for you. Oh, do that. Use this. Take that. Move here. No, do not control, because that's totally out of your duty. Respect them. Give them the dignity that they deserve, and so that they'll be able to get better. Because when they do things for themselves, it's helping them to get better. It's making them know that their individuality has not been taken away from them. It's helping them to know that they are not trampled upon. Their situation is not, people don't trample upon them because of what they are going through, or the challenge they have, or the illness they have. That is very important. So when you are dealing with these people, it may not be in a hospital. Like I tell everyone, it's not about you going for greener pastures. Like I said, you just want to leave. That one is aside. The truth of it is that you can use this particular knowledge on this training. From the first day we started, you can use it in all facets of your life. You may not end up being a caregiver at the end of the day, or a CHCA, depends on what you want. But in your family, you can use the knowledge you have here. In your workplace, anywhere you find yourself, you can use the knowledge, because it would help you to come in handy when you need it. That's the importance of this training. So most times, when you are even assisting those people, your patients, with ambulation, movement, ensure that you are careful. Very important. Ensure that you are careful, because mobility is an essential part of a person's independence. You are independent because now I want to stand up from this place. I'm doing this training with you where I'm sitting. I want to go to another place. I want to walk to the backyard, or walk to the other side of my office. I would walk. Nobody restricts me. I have my independence. I can move. I can sit. I can do anything. There's nothing as sweet as that. There's nothing as sweet to a human being as the ability for you to have and retain your independence. So participating in meaningful activities, having access to food, toileting, everything all requires the ability to move. So you see, movement is very important. But for some reasons, mobility can be restricted. It could be maybe conditions present at birth. There are people that actually have mobility issues from birth. They've had one illness or the other that has stampeded their maybe growth or their ability to move. So they have these mobility issues. It could be as a result of the illness. It could be lack of regular exercise, or movement. It could be physical injury or even medications. There are times due to medications, a kind of maybe harsh medications given by the people that are not actually professional, that don't know what to do. They give these medications and it affects people's limbs, affects their bones. They are unable to work. So you see, there are many reasons that someone can actually have a mobility issues. Some of them can be age-related changes. Some of the mobility issues can be as a result of age. Maybe the eyesight, maybe your hearing. With age comes a lot of these things. As we age, most of the parts of our bodies become less active. They don't function as well or as much as when we were younger. So it's something that comes with age. That is the fact. And your muscle masses too, the masses of your muscles will begin to now weaken and reduce. Nervous system, a whole lot of things happen to some people anyway, because I've been fortunate to see a couple of people that have lived very, very long and they are still very strong. So, but that takes, again, that takes the grace of God. So now we have what we call body mechanics. We have things, mechanics, things that can help us. Now, helping your clients. One of your duties is to help your clients move. So helping your clients move is physically demanding. and it can cause serious injury. That's why you see there are some professions we do that we have, that you have waist pain, that you have ankle pain, that you have back pain. Some of these things are as a result of you not following the right procedures to actually do some of these things. As a caregiver, that is one of the hazards of the job. That's one of the hazards. If you don't do it properly, you're going to lift someone and you don't have the proper techniques. Thanks to God, we are going to learn that in the practical transfers. We are going to do transfer, maybe transferring a person from the bed to the wheelchair. What and how are you going to go about it? How would you do that? You need to know so that you don't exert too much pressure on your waist when you are carrying. Because it may not tell on you now, but when you age, these are some of the things that will come later, much later in life. So it's important we learn, and we learn very well. Now, as you do this, as you help with maybe movement, you also take note of safety, the safety aspect of it, to reduce falls, because it will be very funny for you as a certified healthcare assistant. You are falling and your client is falling as well. You are going to help a vulnerable person and the whole thing ends in drama. Maybe you are falling as well as the patient is also falling. It's not something that we wish to happen. So as such, you have to learn the proper techniques as how to help. And the things you need to do to reduce falls. We talked about safety the other day. In homes, if it's a residential facility, do they have rocks? Sometimes the edges of rocks can make someone to fall. If you don't align, if you don't place them well, some children can actually be funny, naughty sometimes. Maybe they play with the edges of the rocks and then it folds. In such situations, you going to assist your patients, you can fall. Or maybe things are kept anyhow, things are not kept properly. It could result into a fall. Very important. So when you are doing these things, before you even attempt to mobilize, let me use that word, a patient, or to go on ambulation, to help your patients with ambulation, you have to ensure that the path is free. That's number one. You have to take many things into consideration. The path is free. What kind of shoes is your patient wearing? Of course, as healthcare workers, you are advised, like I said last week, you are advised to wear something flat and that has the cushioning effect. Don't wear a shoe that can easily slide you. That's very important. Don't wear a shoe that can easily slide you, because if you do, you can slide and fall. Wear flat, comfortable shoes, smart shoes, that would help you. Don't say you want to slay. In health sector, when you are actually dealing with these people, we don't think about slaying. For us, the women, you don't go to slay, because if you don't wear something that is comfortable, you can fall. You have to move. It's just like a teacher in the classroom. You have to wear something smart because you need to move from one table to another. Look at the children's work. You cannot afford to be uncomfortable wearing something that will make you fall. These are things you need to know. Likewise, your patients. What kind of shoes is your patient wearing? What kind of clothes is your patient wearing in the course of your ambulating that patient in the course of ambulation? Because are you looking at the length of the clothes? Is it the clothes that will go under the leg? Maybe the patient said he wants to wear maybe a long gown, and then a long gown, and struggling with the gowns. You are struggling to hold the gown. You are struggling to hold the patient, and a whole lot of drama. So these are things that we have to make it a part of us. We have to make a calculated attempt to assess the environment before we proceed for ambulation, or maybe to take our patients off the bed or transfers. These are things that are very important. But however, like I said, we are going to see the practical aspect of it. We really used to take our time to do practical, because health is actually a practical thing. And at any point too, that you are transferring your patients maybe from the bed to the wheelchair or from the wheelchair to the bed, ensure that you use transfer mechanisms, which we will show you. We have the gait belt. We have what we call the gait belt. We are going to see it. The gait belt is just like the normal belt that you have, that you use. You place it around the patient and you can lift the patient comfortably, maybe from the bed to the wheelchair or from the wheelchair to the bed. This is very important for us to take note. Evaluate the situation. Before you help, make sure you can perform the move safely. That's another thing. Is the person someone you can carry? We are going to learn different ways you can carry a patient when we do the practicals. You see it firsthand. Are you going to lift? Or maybe the person is a very slim person that has less weight, and you that you are going to carry, you are a very fat, I mean, I beg your pardon, maybe the reverse. The patient is the fat, and then you are the slim, and you are struggling with your energy to lift a very fat person. What do? These are things that we are going to learn, as we progress. Very important. So, and also aside that, make sure you can perform. If you cannot perform that particular act, remember to communicate. Reach out for someone else to assist you. And at every point in you carrying out your activities of daily living, regardless of whichever one, ensure that you communicate. The need for communication cannot be overemphasized. Everything that we do in caregiving is all about communication. Oh, you want to lift someone, you need to let the person know you want to lift the person. You want to, I'm taking you out to have fresh air. Okay, this is how I'm going to take you. We are just going to walk gently. We are going to do this. Keep communicating, because it builds trust. It builds connection, and it helps you actually enjoy doing your work. That passion that you're actually looking for, it helps you to build. It helps you to have the passion, because you are happy doing what you are doing. Communicate at every point in time. Remember to communicate about what you are doing and understand the preference of your clients or your patients. And finally, always ask if the client is stable before proceeding. For instance, you want to lift a patient from the bed up on the wheelchair. Maybe you want to take the person out for ambulation. You want to take the person out to take fresh air, or maybe around the environment. As you lift or before you lift, obviously communication is important. You are talking, I want to lift you, please, can you do this for me? Or please, are you okay? Can we get up now? You keep communicating, seeking consent. The person has to give informed consent. Yes. To emphasize, for you to know that, yes, the patient is actually with you. This is very important. And then before you move, ask if the client is stable. Ask if the patient is stable. I remember in those days, many years, when once in a while, when we used to enter back in those years, when I wasn't really mobile, so many years ago, before you mount on a bike to go somewhere, you mount on the bike. The bike, you find out those people that are safety conscious and those ones that actually know what they are doing, because they will ask you, okay, are you okay? Are you comfortable? Can I move now? They always do it. That's a sign of concern, just as little as that. It shows that person, it shows you that, yes, that person is safety conscious. Because take, for instance, you are not ready to move and the person just assumes you are already there and is moving. It will result into an accident. So that's just the same thing when we are handling these people. We should communicate. Okay. Please, and are we together? Can we?
Yes, ma'am.
Yes, ma'am. Yes, ma'am.
The fact is, I've not even heard any man's voice on this platform, and I don't know. I don't know what is happening, because the truth is, people think that caregiving is for women. Men sometimes they feel it's a women's thing, it's a woman's thing. So anything care, women are already destined to be carers. So I don't know if there's any man on this platform. So permit me, I crave your indulgence. I have to call men. I have to call them so that I will know if they're actually here, because attendance, like I said, we take attendance every day. BCC, they take the attendance. If you see in the group, you see that we already have representatives. They take attendance. So when it comes to certification, if you don't have up to 80% attendance, remember that your tuition fee is non-refundable. You have signed it on the form. So if your certificate does not get to you, it's actually not, it cannot even be a legal thing, because you already signed it on the form. So please, let's try to be present, please. Let's try to be present. So I don't know if men are actually here. Mr. Benga, are you here with us, please? If you are here, just let me know you are here. Mr. Benga Akinlade. Okay, you see what I said, that I know, because the men's voice are, baritone, and I've not heard any baritone voice responding to me. Okay, Engineer Ahmed Nasiru. Okay, they are still coming back from work. Let's hope that they will join us. We have more of women anyway. We don't have men, too many. So, Mr. Omojesu, Michael. All right. I said it, that they are not here. Okay, for the women, I know the women are here, so. Okay, so remember, like we like to say, 6:30, we are going to have our break as usual for us to go and exercise ourselves. So let's see. Okay. All right, so let's continue. Please, can I continue? The women that are here, can I continue?
Yes, ma. Yes,
Ma,
ma.
please.
Okay.
Hello.
Yes,
Can
I
you hear me,
asked
ma?
the other time if yes, I can hear you.
Helen speaking, ma.
I just wanted to, means Helen, you really live long, because I wanted to call you. I just wanted to say the other time Helen was not able to hear me, and then you just called. All right, Helen, nice to have
Yeah.
you here. I'm happy I can hear you now. Yeah,
Okay,
do you
thank
have
you.
any question?
Yes, my like the first time I omitted my mic, that's why, but I've removed this thing. So I want to ask now,
Oh,
like the first week I was unavoidably absent. Then I've not registered.
absently.
So, yes, and you're talking
Yeah.
about 80% attendance. So what do we do? Because I don't want to, like, I don't want anything to come from, like, any faults to come from my own end. So what do we do about it? And again,
Okay.
the previous class, can somebody get a voice record of everything? Because when somebody listens to the voice record and also going through the notes, it helps a whole lot. You understand? So I don't
Okay.
know,
Thank you so
is
much,
it recorded?
Helen.
The previous one and this one, are we getting
Yes,
record?
yes. Yes, it's recorded, Helen. It's recorded.
Okay, so
Now,
you
in your case, I talked about 80% attendance. In your case, you registered a bit later than the others. It's not a challenge. It's not a challenge in the
okay.
sense that you missed the first week. Hence, I ensured that you had the slides. For everyone, they are living witnesses. They are still on this platform. What we had given to them is the slides and the video too for that particular day, 2 days. For those 2 days is what I
Okay.
have dropped. None of them has the recorded version of what we did yet.
Okay.
But today and tomorrow, none of them, they are all here. None of them. I actually gave the slides and the video to them. Now, for the recorded version of what we did, everybody would have it by God's grace this week.
Okay.
Before this,
Okay.
we have today, tomorrow. So let's just give or take before, say, Friday latest, they will have it. And
Oh,
we can go or what we normally do is we have a channel where we just ask you to go there. You get the recorded everything, including the slides from the beginning up until the end. So trust me, you are not going to lose out in any
okay, ma.
aspect.
I
I'll
appreciate that.
ensure you don't. Today, before you joined us, like I appealed to them to give me just few minutes so that you'll be able to join, since today is your first day, which thanks so much to everybody, they understood. So it's
Yes,
fine. Would all do it together. We'll all conquer everything. Don't worry, Ellie.
it's okay. Thank you, ma. I
You're welcome.
appreciate it.
You're welcome. So I was talking about dressing. Does any other person have any question? Okay, maybe I should continue. Now we want to look at dressing assistance. Dressing assistance. Now, dressing is not just about wearing clothes. It's not just about I want to wear this, Dressing starts from you even thinking about putting on a particular dress. In this particular setting, as a certified healthcare assistant, we keep talking about communication. Do not superimpose, exercise power over your patients. I keep saying, rather exercise power with. Exercising power with a person is like a husband and wife exercising their power. This one says it should be like this. I'm thinking it should be like this. What do you think? They are all rubbing minds. They are all talking. But when you exercise power over, it's like you giving your decision. You want this. It has to be like this. Okay, my patients, you are wearing this today and we are going here. No. That's very wrong. You can make it beautiful. You can show that you respect your patients by saying, okay, today would you like to go out today? Or maybe says, oh, you've indicated interest that you would like to go out today. Maybe you'd like to visit or you'd like to do what? Okay, it's time for you to take your bath. I'll help you with this. Would you like me to help you with that? They have to give consent. You not just say, okay, you have to bath. Okay, I want to do this. I want to do that. It's all about you. It's all about I, and it's all about me. No, no, no. It doesn't work like that when we are doing this business. So in this dressing, you express they have to express themselves. They have to be comfortable in whatever, in that vulnerability that they are. So when they want to go out, even in terms of the clothes that are hung there, maybe they have a wardrobe that they have their clothes, it is in your place to say, oh, you can pull out maybe 3 clothes or 4 clothes for those that maybe cannot even walk, and show them, okay, I have this, I have this, I have this, I have this. Please, which one would you feel comfortable with? Which one do you prefer? Just that, even minus a vulnerable person. You as a mother, if you relate like that with your child, even a little one, is okay, I have these clothes, my dear. Which one would you like to wear? Already, you have, I mean, I don't know how to put it. It just makes that person feel good. So, let alone a vulnerable person would say most likely, oh, I would like to wear this. And always compliment them. Oh, you like to wear, oh, it's beautiful. It's a nice one. You drop it. Communication is everything. Everything you do, communication, the way you communicate with people, I tell you, can go a long way, making things either easy or difficult for you in any setting you find yourself, regardless of the fact that you're in the health sector. So keep communicating, engage your clients by allowing them to choose their outfit like we talked about, because it fosters independence. It shows that, yes, they are that part of their life. They are still in charge of their lives. That alone is therapeutic. It helps them to get better. It helps them to get better because they know that, oh, I'm not totally useless. I'm not, people that are vulnerable, you need to have some of them for you to really understand what I'm talking about. If you have some of them, or you've been in a state whereby you are vulnerable, you cannot help yourself do certain things. You are feeling like the world has come to an end. You are feeling, why me? You are feeling demoralized. You are feeling depressed, a whole lot of things. You will understand what I'm trying to say. I pray none of us really gets there. So that is why talking about their preferences, talking about their independence, talking about respecting them, we cannot roll it out. In all the modules, you keep seeing this particular word, these words that I keep talking about, dancing around, because it's to show emphasis. It's talking about emphasis. So it is important you respect their preference. This is what they want. This is what I want to wear. So be it. Allow it to just be the way they want it. It is only if it's something that is detrimental to them, you make them understand that this thing will not be good. This is the reason why it's not good. This is the reason why it's not good. You talk to them, you appeal to their conscience, you appeal to their sense of reasoning. You let them understand why you are doing this so that they will not feel as if you are forcing them. Because if they feel you are forcing them or killing their self-esteem further, it becomes a problem. It will not help them in their health. And of course, why are you there? Then if not to help them get better, that's why you are there. So that is practically about dressing. And when you are dressing them too, consider the fact that some of them maybe people that have, maybe, for instance, maybe you have a person that has stroke, or heart stroke, a person that had stroke or has stroke, one part of the body, one part of the hand will actually be weak as a result of the stroke. Take note of all these things, depending on what illness your patient actually has. Clothing that fastens in front, clothes that ensure that you get clothes that are easy to wear, that are easy, that is easy to maybe remove, that will not be stressful for them while it is being removed because of the weakness of their arm. And when you are dressing them, which is a skill that you learn, like I told you, all the skills, we are going to dissect it, like dissect them when we are doing the practicals. We are taking the skills. We thank God that we have this. So we'll take our time, and everybody has to be carried along. Now, when you are dressing a person that has a weak arm, dress the affected arm first. When you are wearing a person dressing, dress the weak arm first. Very important. The affected limbs or the affected hand. For instance, you have a person that has stroke. You should know, because communication, interaction, connection, and you have the person's care plan, you know what is the person's challenge. Now, dress the part that has that challenge first. That is the part you start wearing. Maybe you want to wear a shirt. That's where you carefully ensure that the person's hand is into the shirt before you now reach out for the other side. Very important. So in you dressing a person that has a weak arm, dress the affected limbs first, the affected arms first. But when you are undressing, take note, there are two different things. Dressing, you use the first part for you to wear the shirt is the arm that is affected. But when you are undressing, removing the clothes, you are undressing, undress the unaffected limbs first. So dressing the affected arm first, undressing the unaffected arm first. Nevertheless, do not worry. Anything you don't hear or you don't understand, I've told you that this is the theoretical aspect of it. The practical, that's when you see all these things that I am saying. And you see how it's in real life. So those people that are saying physical and no physical, there's no difference between the two. By the time we get there, you yourself will attest to the fact that there's no difference. I pray network favors us. So that's practically what you need to know. Make sure that they wear things that are easy, maybe with buttons that you can easily remove and help them remove. People that have affected arms, don't wear them clothes that are tight-fitted, that they'll to remove, where the hand can have issues, and in the process of removing, you will have incur more harm. You'll be adding pain to injury that the person already has. So these are things we need to take note of. Also, eating. Nutrition is vital for health too. Assisting with meals ensures that your patient receives the necessary sustenance. When you are helping a patient to eat, encourage them to participate as much as possible in the food. Like I tell people, even if it's like for mothers, I tell mothers, encourage your children to participate. Any child that participates in either creating the menu for food or in the preparation of the food eats. If you have children that are picky eaters, that don't eat, don't like to, they select food and do all those things. If you get them involved, most times to 70%, like when I used to take classes for children, like I used to do child education, maybe parenting. There are times I have classes for parents and parenting in schools. So I tell them it's not all about I'm the mother, I'm the father. No, sometimes allow them, let them feel free, let them choose. Even if they don't choose, even if it's what you want, you try to integrate them into the process of actually doing that food, making that meal, or drawing the menu, or doing certain things. That alone already is going to make them eat that food, even if it's something they don't want to eat. So what am I saying? In this case, when you carry your patient along, find out what are the patient's preferences now that are within the scope of a person's health, like I said. So you ensure that what the person actually eats is not detrimental to, even when the person wants to eat something that is detrimental, like I said, work with a care team 24/7. Don't take unilateral decisions on your own. Work together with them so that at the end of the day, you'll achieve what you actually want to achieve. And then encourage them as much as possible. And you could help them too. Don't be all about maybe feeding them. You want to put the food in their mouth because they are vulnerable. You just feel that, okay, I'm a certified healthcare assistant. Let me do everything. Let me feed them. Let me do. No. You may think you are actually doing a good thing, but the fact is that you have taken away their independence, especially to those ones that still have a level of ability in them that can do these things that you are doing for them. They can do it by themselves. It will not go out well. So there is what we call hand on hand technique. It helps you to guide. You can guide a person. We'll show you when we are having the practicals. Guide a person to actually eat with his own hand, which would go a long way in helping. And if you have people that have dysphagia, there's something they call dysphagia. It's an illness that makes it difficult for someone to swallow something. So if you have people like that, you have to ensure that you take it easy with them. Do not rush. Never you be in a hurry because you are doing a humanitarian service. Never you be in a hurry to want to leave. We also have the toileting assistance too at this particular point. Toileting assistance. How do you assist in the toilet? That has got to do with toileting. What do you do? Very, very important. Now, helping with toileting is something that is very, very, it's a personal thing. You and I know that when it comes to toileting, cleaning your perineal area and all those things. You wouldn't want someone to do it for you on a very fine day. So, but if life has dealt a blow on you or on your patients that you have to do that particular sensitive and personal act for the person, you have to do it with all level of dignity, respecting that person. So toileting, you have to ensure that you know your patient's toilet habits. Yes, you know your patient. That's part of communication, connecting with your patient. You should know, oh, as I deal with this person, he usually uses the toilet, you know, bowel movement. Thank you. That's the right word. So his bowel movements is like this and it's like that. I have to ensure that. And privacy, I cannot overemphasize that. Privacy is very important. Like you see that picture, even in a place, you need to, because sometimes they can feel dehumanized. Sometimes they can feel embarrassed, you know, when someone has to take care of your personal parts. You know how that kind of thing can be. And in the course of you doing these things, do not at any point. I've seen situations whereby maybe you have to assist for toileting. You go into the toilet with your patients, maybe to assist in the toilet, and then you end up showing expressions that is, I don't know how to put it. Maybe if the toilet is passing, the person is actually passing out excreta, maybe in the toilet or something, and you are like frowning your face, you are like, smelling or making whimsies or doing some things on your face. Those things are unacceptable as a CHCA, I must say it. When you are cleaning, because sometimes your duties can involve helping someone that cannot do it. Maybe after the toileting, you have to clean, you know, for women, you have to clean. And whenever you are cleaning, especially for women, please clean from the front to the back to avoid infection. That we will show you too when we are doing the practicals too. Clean from the front to the back. That's clean from the vagina all through to the anus, and you take out, maybe you discard of what. Don't start from the anus to clean to the vagina. It's not only something you should learn as a CHCA, you also need to learn it as parents. Teach your daughters. Why? Because the way a female, the female anatomy is, we've talked about anatomy. Now, the way the body is for a female is open to anything. That's why women easily get infection, contact infection, than men, just because of the way our system is the way our system is. So when you are cleaning, even as you are a CHCA, clean from front to back. Perineal care, that's perineal care. When you have to clean maybe urine, or you have to clean anything, be very, very careful. Clean from front to back and discard. Also, there are other things. Maybe you have patients that have a urinary incontinence. That's sometimes urine escapes, like I said. It can be an embarrassing situation. So you have to think of the psychological aspect also, how you can help that person to be able to handle the situation, because it's an embarrassing thing. Most women cannot even tell another woman what happens, let alone maybe, you know, say it to total strangers. So you see where communication comes in, you see where connection comes in, because when you connect with your patients, you have that bond with your patients. It's just the way you are with your child as a mother, as a parent. Yes, you connect with that child. I tell you the truth. That child will confide in you. Before any situation gets worse, you will know and you'll be able to handle it. Because why? Because you have connected with the child. But in a situation where there's no connection in anything, then there are issues. Because failing to connect, especially for your children, sorry, I like to talk a lot. I'm a teacher, so sometimes I digress. So at such points, that child feels more comfortable to connect with an outsider, and that is why most children are exposed to hazards. So in this case, likewise, let's relate it to this. You connect with your patient, because when your patient has issues, he or she may even be scared to disclose to the other members of the healthcare team who will talk to you because of the connection, because you are the closest as a CACA. You interface with them on daily basis. You smile with them, you talk to them, you ask them how they are doing. They can share their past with you. They can relate with you. They feel comfortable with you. If you are a good one, after all, if you are a good one, then that's the situation it should be. You understand? So these are things we should take note of. Privacy is very important. Do not show them any form of embarrassment. Yes, I'm not saying you should be there and perceive any kind of, I didn't say that with that, but I'm saying that as much as possible, you have to help them if they are not able to do those things for themselves. There are some that may say, no, I can handle it, but you can, to give them a little privacy, if you see sense that they are feeling anyhow, you can turn your face the other way. still there. You don't have to leave them outrightly, depending on the level of assistance. You can turn your face the other way and they do whatever they need to do. Or practically, you can help them do it if they need that level of assistance. But in everything you do, keep communicating with them. Let them give you the consent before you go ahead to do the things that you want to do. This is very important. I decided to delve on that because this particular aspect is very, very, I don't know how to put it, it's very important to everybody. And you wouldn't want another person to do it. So if someone is doing it, the person has to do it with all level of respect, not demeaning you and making you feel dehumanized or less of a person because of the challenge that life has thrown at you. So this is very important. Privacy and use appropriate language. Important. Use appropriate language when you are using these things. You know, very important. Okay, so safety too is essential that you are careful with safety. The bathroom mats should be such that has the cushioning effect. In fact, people are advised now not to use the bath. Do not use the bath. They maybe jacuzzi or the bath thing. It's because we've recorded a whole lot of deaths, accidents from maybe coming out of the bath tub and in the process of keeping their legs because of one thing or the other, it has ended so many people's lives. So now people are advised not to use that. Use the standing. You just go in and stand and have your bath. In a situation whereby you still have to use this, maybe because of the illness the person has, you have to be extremely careful. Slippery, any little thing can make you have an accident. So these non-slip mats are very, very important. Rails, you have to have rails, maybe things that they can hold, especially with people that are vulnerable, things that they can hold on to while they want to move. It's very, very important for us to avoid us having accidents and check for hazards. Anything that looks like hazards in the bathroom, take notes of it and do something about it. So at this point, like I said, we would, 5 more minutes. When it's exactly 6:40, we'll take our break. We'll take our break for 15 minutes and then we would be back. The next part is not very extensive as this. I needed to take more time in this. So let's quickly look at the challenges faced with this. Now, like you have, from now, you are going to be seeing slides, challenges faced with ADLS, resistance from patients. Sometimes you have patients that will resist this assistance. Maybe they are not in the mood. They don't even need it. You want to help them with bathing. They just maybe shout, have to raise their voices, or they turn and show you one attitude. They don't need it because of maybe embarrassment, or they are feeling that they can't do these things for themselves. It's frustrating. That's the word. So what is the strategy that you need? Build trust and rapport. I've already said this thing. You cannot function effectively as a CHTA without trust and rapport. It cannot work. Even in anything you do without trust and rapport, it cannot work. Even as you're on this platform, you agree with me that a whole lot of people wanted to enroll for this program, but they are like, oh, especially those that are not members of our alumni community. Maybe they've not taken any training at all with us. They are like, should I go in, one leg in, come out? Some are scared, you know, all those things. Why? Because the trust has not been built. But those that have taken trainings with us, as we have, because they have done 1 or 2, they can go and sleep. In fact, even if we have 10 and they are interested, they can just do it knowing that, yes, because they have built that trust. So that is what trust does. Trust is very important in any relationship. So when you build that trust, it's easier for you to meander, to maneuver all these feelings of frustration, embarrassment. You can handle them when they come face to face as a challenge to you. You know, communication, show empathy, encourage your patients to express their feelings. Let them talk to you. Offer choices that can empower them, such as letting them decide how much help they want. Like I already said, don't take away their preferences. This is important. Physical limitations too. You may have maybe clients that have limited mobility or strength, which will make it difficult to assist them safely. They cannot, maybe they'll lean on you entirely. They lean on you entirely. So you need to have body mechanics. You need to have some techniques to be able to handle them. You need to help them with assistive devices. You know, you need to have a good knowledge of how to use these assistive devices in order to prevent injuries to both the caregiver and the patient. Okay. Good. And then we have the emotional and behavioral issues too patients may experience anxiety, depression, cognitive impairments. Thank God that we have mental health awareness. We are going to learn it here, that you will have an extra certificate because it gives you an edge. Once you go through that training, it will be easier for you to meander. You'll be able to handle anybody that is having mental issues, that's mental health issues. You will understand how to meander it by the time we get to that particular training, mental health awareness. That is there, an added advantage for you taking this training. So all you need to do is you have to be calm, patient, and calm with them. Create a routine to provide structure. Let there be some form of routine that will help ease some of these things. A routine in the sense that they'll know that by this time, it's time for them to take their bath. You know, by this time, these are the things they have to do. When they are used to that routine, most of these issues will be handled even before you get there. You know, you can also use some therapeutic therapy, things that could help them. If it's those that love their grandchildren, like I like to say, if those that love people, loved ones come around them, you can make, if they are tensed up, if they're emotional like that, they are having those depression issues, the only medicine is for you to handle them with therapy, to give them therapy. Let them talk about the things they love doing, the things that bring good, beautiful memories to them. You see some of them, they'll snap out of that particular mood, and it makes your job easier for you. Time constraints too. Most of our caregivers, you know, time, you have to attend to Peter, to Paul, to Titus, to John, you know, and you are on the run. Like, I don't have the time to waste here. I don't have the time. I have to move here. You know, you have to rush here and there. It's understood. But at the same time, prioritize your task. Understand that everybody is special. Every patient is special. You can connect with them. You have a very crucial role to play in their lives. So that is very, very important. Incorporate flexibility to address issues, because sometimes issues will come. The issues you don't prepare for can just come. So it's very important that in the course of you doing these things, you prioritize, you set realistic schedules, you incorporate flexibility into what you actually do, so that when these issues come, you won't be saying, I don't have the time, I cannot do this. No. Of course, you need to have the time for them, because because of them, you are actually there. So you have to have the time for them. So communication barriers too, we've talked about communication. There are people that have maybe hearing impairments, you know, dementia patients that maybe they have entered the second or the third stage of dementia. It's difficult to communicate with such people. So the things you can do, you use clear, simple languages. And don't use non-verbal cues. Don't use signs and all those things that they cannot comprehend. You know, employ tools. It could be pictures. It could be things you feel they can easily understand. It could be boards. You can communicate, show them the board, they understand what it means. You know, for clients who have difficulty understanding spoken English, that's another thing. So communication is a barrier. That's why if you want to go to some countries, they will ensure that you learn their language so that that communication gap will be breached. We also have cultural sensitivity. People from different cultures may prefer have different preferences for maybe how they are taken care of, maybe their hygienic practices, maybe their dietary restrictions. They may have different cultures entirely from your own. So what you need to do is educate yourself about the cultural backgrounds of your patients. It still boils down to the same thing: communication, bonding, connection. Ask them the things they have been through. Ask them the things they like. Ask them how they love their things to be done. Ask them the things that make them happy, you know, a whole lot of things. So all these things, you bond with them. It's not wasted moment, because it makes your job easier for you. Discuss their preferences. You can talk to them on a fine day they are happy. You discuss with them. They will tell you a whole lot if they have bonded with you. Finally, before we go for break, infection control. That's another thing. Ensuring proper hygiene is difficult, especially if you are not in places that conscious of their hygiene. Like some places, Madam Mildred did say something the other time. If you get to such places that they are not even conscious of their hygiene, what are those things that you can do? Follow strict hygiene protocols. Wash your hands. Protective PPE equipment. Do not lose guard of those things. Educate patients on the importance of hygiene to encourage them, because like I said, anything that someone knows, it will be easier for the person to understand. But anything the person doesn't know A to Z about is difficult. So encourage them, discuss with them, let them know the reasons why they have to be conscious of these things, why it is important for them, for their well-being, for their health. When you tell them with time and with the connection, they will get to understand that you actually have their interests at heart. Then finally, I think maintaining dignity and privacy, assisting with personal care, sometimes infringe on patients' sense of privacy and dignity. I already told you that sometimes people feel embarrassed when you do those personal things for them. So always ensure that you give them that privacy during care tasks. Use curtains, use screens. We have a lot in the hospitals, in care homes. Use them, cover them, give them that privacy and explain each step of the process to them to reassure them. Let them give you consent before doing it. Good. And I think this one talks about us as caregivers. You get to a point where you have you can be emotionally burnout. That's, you can just be tired. You can just be fed up. Maybe you had a bad day with one of the challenging situations that just gets you worked up. Encourage self-care for yourself as a caregiver, as a CHCA. Encourage self-care. Promote support groups. Take regular breaks. When it's too much, go out, breathe in fresh air, gather yourself back and come. We all have different ways that we let go of tension. So you know the way that suits you. At that point where you feel like exploding, where you want to help someone that doesn't want to help himself or herself, you just take a break, loosen up, go out with friends, visit people when you are free. Just try to put your life together because, of course, you need to be well in order to handle people that are fine. Adapting to changing needs. Patients may need to change over time due to their health conditions. So you have to continually adapt to their approach, continually change. Maybe what they were able to do before, as they get worse, they will not be able to do it again. So their care plan is updated from time to time. And as such, you have to adapt to it depending on how the care plan is. Collaborating with other people that are involved too. Stay informed about best practices in ADLS. Very important. So on this note, I'll give you 15 minutes break. Please, we would be back by exactly 7 o'clock so that we can have this first part is the side that is very bulky. The next part is not as bulky as this. We needed to delve more into it. Thank you so much, but I need to know, I just hope I wasn't talking to myself. Are we together, please?
Yes, ma'am, we are.
Yes, ma'am.
Thank you. So
Yes,
please,
ma'am.
that's the voice I like to hear. It has given me energy now. I'll be very, very prepared for the next one. So at this point, please, let's take a break, 15 minutes, stretch our limbs and get better. Thank you so much. And whoever is saying, mommy, please attend to that
Thank you,
beautiful
ma'am.
child. Yeah. Thank you.
Yes.
I'm trying to.
I'll feed you. Yeah. Chicken bacon. Water.
Yes, I want to mute it, please.
See, we use dash for cutting our fingers, nail. What do we use? Nail cutter. This one. So, I finish this one.
I want to finish all this one. Eh? I want to finish all this one. Okay.
I finish it. Then you
Yourself, you know that last time to the milk almost finished. It was only you and Tolu and my mom that took it.
All right. I think we should be ready. Hello, everyone. Are we back?
Hello, ma. Yes, we are.
Okay. I would
Yes,
like
we are.
to. All right. Thank you for coming. I trust we were able to stretch our limbs. We will be done in no time, I can assure you. There are some people I need to. Flora, please. Onyemachi Flora. I've not heard that name. Onyemachi Flora, please. Are you here with us? Okay. Nora. Madam Nora. Let me even see the people.
Yeah,
Madam Nora,
hello.
are you here? Okay.
Yeah, I'm with you. Yes.
Yeah, thank you. Because I've not heard you. I just checked my list and I said, Madam
Please,
Nora,
I'm
what
with
has
you.
happened?
I'm
Okay.
with you, please.
All right.
What?
Thank you. Thank you.
Okay.
Damilola.
Yeah,
Damilola
me, ma.
Sadiq.
Yeah, me, ma.
Okay. Okay. Sarah, that's a Ghanaian. I don't know if she's here. Sarah Ankoma. Madam Sarah, are you here? I don't think so. Mildred. Yes, today I've not heard Mildred at all. Mildred. Hello, Mildred. Okay. Ezinwa. Ezinwa. Okay, and I've seen your comments. Obviously, maybe you have not returned after the break, and Adesoye, okay. What about Ayo Gifts? Please, Ayo Gifts, are you here? Okay, so let's ride on. I just wanted to confirm. Where did we stop? Permit me, let me share my slides so we can fine. So please, I need to know, are we together? Can everyone see my slide?
No.
Yes, ma.
Yes.
Okay, thank you. All right, so we are going to just continue from where we stopped before the break. So before I delve into the set slide, please, I'd like to find out, do we have any question
Don't
or
wash
any
hand.
contribution,
Wash hand.
or anything that
What domino?
I want to share? Is there any question, please? No one is asking me any question and no one is sharing anything. I used to enjoy those health trainings because I get to hear a lot of things and people share their experiences, but I'm wondering why. Maybe because some of us may be tired. I don't know. So do we have any experience to share, any contribution or any question?
No, ma.
Pardon?
No question yet, ma. Hello, ma.
So if we don't have, yes, please. If we don't have any question, then let me ride on. I think we are on the same page. So now we want to look at nutrition and hydration. Nutrition and hydration is the next module. Now, food is very important to us. And before I continue, I want to ask, what do we, thank God we are mostly ladies on this platform. So for a lady and for ladies that we are in charge of the kitchen, what do you consider balanced diets? What do you think is ideal to be in a particular meal for you to consider it, for it to be termed as balanced diet? Who is going to help us? Any of the mommies in the house or the women? You don't have to be a mother to know what's balanced diet. So who is going to help us? What can you term as balanced diet? Or when a person eats healthy, what are the things that the person needs to take, needs to be constituted in the person's plate for you to know that, yes, the person is eating healthy? What are some of those things? Please, who would help us?
Ma, do we even have balanced diet now in Nigeria? I'm very sorry to answer that question. Do we even see a balanced diet in Nigeria?
Who is saying that?
Helen,
Let me know the person that is saying that. Who is saying that? Okay,
It's
Helen. Helen, are you the one saying that in Port Harcourt, where we have all the things that can make? Don't say that though. I know things are hard, but in the midst of it all, we still try to. That's being on the on the lighter part. Okay, so what is balanced diet? Who can help us now? I don't want to be sad today because if I don't get response, then there's the means we'll transfer this particular balanced diet and nutrition to tomorrow so that maybe people can give me the answer when we come. So who is going to help us? I should just call. Okay, maybe I'll just do the calling. I'll just call anyone. What do we term as balanced diet? Madam Abidemi, please. Are you here? Madam Abidemi. Okay. Madam Abidemi is not here. All right. What is balanced diet? We are mothers, and we are women. So what are those things that we can term balanced diet? Or I should continue. Okay, Kate. Kate, help us. Kate, Paul, are you here? It's like people have left me. They've just left me that let this woman keep talking endlessly.
Yes,
Hello.
Yes, please. Who wants to respond?
Hello. This is Kate. Can you hear me?
Okay, Kate. Yes, I can hear you.
Okay, let me just give it a try. Okay, I think when we talked about balanced diet, it has to do with having an appropriate portion of all the classes. It might not really be all the classes of food, but the most important part of it, like when it has to do with fat, proteins, water, possibly minerals. So having a good quantity of it in every set of meal, I think that is just a simple term for a balanced diet.
Thank you. Thank you very much, Kate. Thank you. You have really tried. You have tried. Someone else wanted to contribute. I think Osareme, was it? Am I correct? Osareme,
Yes.
I think you were the one
Good
that
evening,
wanted. Please, can
everyone.
you add to that? Good evening. Good
Okay.
evening.
Good evening.
Okay.
Yeah.
Balanced diet is food that contains the adequate classes of food, at least.
Beautiful. You see why? Well, the only problem was to make you people talk, like to talk, because I know that we have we have seasoned professionals on this platform. The only challenge is for them to share their wealth of experience with me, since they know that I am not going to pay them for their service. Maybe that's just the only thing. But thank you so much, Madam Osareme. Thank you, and Kate, for those responses. So practically, the A to Z of it is having at least a good quantity of the different classes of food. We still remember our science: carbohydrates, protein, fats and oils, vitamins, water, and
minerals.
so on. Thank you. Minerals, yes. So all these classes of food. So it is important as a CHCA for us to understand these things, some of these things that we have here, because when we understand, we'll be well equipped to take care of ourselves as caregivers primarily, and then extend that care, knowing what we are doing with our patients. So nutrition and hydration is the next topic we are going to look at. It is very, very important that we take foods that have that would give us the nutrients that our body actually needs. We talked about anatomy the other time, and this food, these are different types of food that we take would get into our system, and the parts of the body will function doing what they can do. Remember homeostasis we talked about. So it is important that when we eat, at least we should have different little. There should be fruits accompanying your meal. You should have vegetables. You should have water. All these things put together is very important, as well as for our patients. But take note before I go deeper into it. Take note of the fact that vulnerable people have their dietary restrictions. That's what I want us to understand. So there are people that they may say, because of the illness, because of the challenge they have, okay, do not take this or do not take that. So this is simply not cast on concrete. It's not cast on concrete in the sense that if there are patients that have dietary restrictions not to take some specific kinds of meal, you will not say because of balanced diet, you go ahead and give to them. So despite the fact that we are learning this, we should still bear it in mind that we have to align with the care plans and understand that not every patient needs to take every kind of thing, because of their dietary restrictions. But overall, it is important that we note that fruits are very necessary, and then vegetables too. Our meals should come with vegetables, should come with all those in their right small proportions, like we can see here. Another thing is, as much as possible, we should not advise our patients to take junk foods like fast foods, like chocolates, like you can see their pizza, hamburgers and all those things. As much as possible, they should be discouraged. That's the word, discouraged, not to be stopped, because you cannot impose on them, but they should understand the need why they shouldn't take this different meals. And on this particular one, when we talk about this nutrition and dehydration, please take note that it's a two-way thing. It's also important for you as a caregiver as well as the patients too that you are taking care of. So overall, it is very important, because food is important to sustain life. It's important to keep you healthy. It's important to make you maintain your balance. Very correct. So now let's look at, like I said, we are not going to really we are not going to take too much time this way, because that's activities of daily living that is very important. Okay. So what is this nutrition? We are talking about nutrition and hydration. What is nutrition? Now, the process, like we have there, of providing and obtaining food necessary for your health and for your growth. That is the A to Z of nutrition. What about hydration? Water, fluid. Anytime we hear hydrate, that's water. So what do you take the sufficient fluid that your body needs daily? What about your patients? As they age, as people age, becomes it becomes more important for them to stay hydrated. That's to have fluid in their body to stay hydrated, except those that specifically have challenges. So it's very important that we take care of the things we eat, the things that our patients eat, because what you eat affects you, affects your health, affects your stamina, affects your lungs, affects all the parts of the body that are intertwined. So your homeostasis state is affected by what you eat. It supports your overall health. It prevents your malnutrition and dehydration. When you actually eat well, you take water, it helps you not to be malnourished, and it helps you not to be dehydrated, which can lead to serious health issues. Now, most of us can relate to this. If you are dehydrated, dehydration is the fastest and easiest thing that can make someone to just, I don't know how to put it, but it's very easy for you to just go to the other side of the wall when you are dehydrated. I've had a situation whereby someone was throwing up and at the same time purging. That's the worst kind of purging, bringing out water. You know how purging can be, watery stool, and then also throwing up. At that point, that's why when someone throws up, it's advised as fast as possible for you to give that person, in the layman's language, we call it salt and sugar solution quickly, just to ensure that that person retains fluid, or ORS as it is called, so that that person can retain fluid, because dehydration is very, very bad. Now, what's another importance? Because you are dealing with vulnerable people that most likely their immune system are affected because of the illnesses they have to take enough water, they have to take nutritious meals so that they can recover, and it can help to boost their immune systems. This is important. All right. Now, let's look at dehydration. Let's look at dehydration, like I was talking. Dehydration is simply talks about you not having sufficient water. Sometimes when you talk, like when I do trainings like this, I'll talk a lot. I like to drink water occasionally. Like during that break, I had to take enough water because, as you keep talking, at a point, you feel as if your saliva is like drying up, because you need, that gives you a signal that you have to take in fluid. You have to take in fluid so that you retain a fluid in your system. So the average adults, like we talked about, no one reminded me that we didn't put this in slideshow. Okay, fine. So I think this is better. So the average adult should aim at least 2 to 3 liters of fluid per day. Individual needs may vary, like I said. Depends on your age, depends on your activity level. Like someone that is very active, maybe you just back from the gym, or you do a very rigorous you do a very rigorous work. So as such, you need to take in more. Depends on so many things. The climate, your health conditions can restrict you from either taking more water or taking less water. So it depends, but averagely, an average adult needs to take at least 2 to 3 liters of fluid per day. It may not necessarily be water, because water is not the only fluid, but water is very important. Water is very, seriously important. So older adults, as people age, as you get older, you may require more attention to hydration. You may, if you are a patient and you are older, the elderly ones, you keep reminding them, you ask them if they are thirsty, can I get you a cup of water? You keep, because they need to take water, depending on their health challenges anyway. Why? Due to decreased thirst sensation. As you age, originally, automatically, you have decreased thirst sensation. Most times, you find out that most people, maybe in their 70s, in their 80s, they tend to not taste something. That's to feel the taste of something. Sometimes they can even eat something that is actually not bitter. They feel the thing bitter. Or the food, maybe bitter leaf, now they can even taste bitter leaf. Like my grandmother, before she died, she can chew bitter leaf. She'll just taste it, and she'll tell you, this bitter leaf is not bitter. But when you yourself, you pick the leaf of the bitter leaf and put it in your mouth, you cannot even chew it, because it's like hell bitter. So as people age, their taste buds begin to have issues. They either don't taste anything at all, or bitter things, So as such, they have to keep, you have to keep ensuring that they are hydrated. That's, they take enough fluid into them. Now, also, individuals with certain medical conditions may have different hydration needs. That's why I keep stressing it. So these things are not cast on concrete. It depends on what the person actually has, what is the challenge the person is actually going through. Okay, now, sources of hydration, like we talked about, water. Now, I like to refer to water, or I like to talk about water as the forgotten nutrients, because so many people are not conscious of it. Forgotten nutrients. People just take it for granted. Oh, water, they may even be tested and they just overlook it and, you know, and so on and so forth. But the human body really needs water. A lack of enough water in our bodies not only makes a person feel bad, but can also lead to heart injury, kidney. That is very important. You see the reasons why we keep having kidney diseases skyrocketing, because one of the reasons, because there are other reasons too, but one of the reasons is water. If you are dehydrated, it is a problem. You keep taking water because water is just the best. It's the best. We have other fluids like beverages, like tea. Some people take herbal teas, and then milk and whatever. But the most important source of hydration is water. Now, let me shock you. Just 2% water deficit. I mean, 2%. I'm not even saying just 2% water deficit can cause a lot of things in your system. Can cause fatigue, confusion. You can begin to have blurred vision just because of dehydration. So it's not something that someone should just take like that, very, very lightly. For yourself as a caregiver and for your patients too, based on the care plan. If your patient doesn't have any restriction in terms of maybe taking water, you should continue to ensure that that person is, your patient is hydrated, takes in enough water. It can cause a lot of things. Your mood changes equally. It's as little as that. Mood changes can even be as a result of dehydration. Take note of that. It can cause so many things. Urinary tract infection. We women, most times you say you keep treating this infection and treating that infection, or your patient keeps complaining of having one infection from one infection another. Why? One of the reasons is water. If you take a lot of water, especially people that have, what do they call it? UTI, that's urinary tract infection. You take a lot of water, the water flushes your system. Water flushes, cleanses your blood, flushes your urinary tract, and clears any infection that is there. So it is important that we don't joke with water. Other fluids too, as well. And then foods. You need to take foods such as fruits and vegetables that have high water content. Like I told you, it's not only water. You take things like cucumber, they give water extraction. We have lots of water. Watermelon too comes with a lot of water. Ensure that your patients take them, they get hydrated. You may even be working in a residential facility, in a home. So it's not all about you working strictly in the hospital as a certified healthcare assistant. You can work or attached to a person. So you have to ensure that based on the person's service care plan, you ensure that the person is, if the person cannot take too much of water, the person can make do with fruits. Take fruits that will at least keep that person hydrated, depending on whatever it is in the person's care plan. You know, soups and stews too are excellent for both hydration and nutrition too. So it depends. Now, here you would see a healthy eating plate. Like we can see there, a healthy eating plate. This is just an example. When you eat, at least you should ensure that whole grains, protein, fruits, you have little fruits, you have vegetables, you take water, and a little bit of all this food, small, just as you see it there. They have so many things that are under, like vegetables. There are so many fruits. There are so many sources of you getting vegetables. May not be leaf vegetables, it may be fruits, vegetables. You know, you put them and ensure that little by little of it is contained in every meal, so that it can help you to remain healthy. Not only helping you remain healthy, also helping your patients as well. You need to have the knowledge so that you actually be able to guide them and make them understand certain things. Because like I kept saying, a CNA, certified nursing assistant, your role is not as broad as a certified healthcare assistant, because like a couple of you asked on the group, because as a certified healthcare assistant, your job extends to even you creating awareness. You do a lot of awareness creation. When it has got to do maybe times where we have to give immunization, we have to maybe go into a particular community to give to sensitize them, to create awareness concerning certain things, you see that that's part of what you would do as a CHCA. So it helps you when you have the knowledge, because of course, who can give what he or she does not have? You have to have the knowledge so that you would be able to attend to all those needs. Now, signs of dehydration, like I said, you can spot the signs. First, dry mouth and lips, like I was talking about. I told you that when you talk for too long without taking water, some of us feel it. You find out that it's like your saliva is drying up in your mouth. That's a sign that you are dehydrated. You have to take in water. That's a sign for you that you're taking water. Fatigue, dizziness, confusion, irritability, mood swings, a whole lot of things that can result from dehydration. Signs that you can observe, that you can read the handwriting on the wall, or your patients can actually have these challenges. You can read the handwriting on the wall and sense that it could be as a result of this. Also remember that you are also performing a reporting duty. Reporting in the sense that you have to observe your patients 24/7 at least for the period you are there, because in some of these facilities, they run shifts. So you can have, hey, on generator.
NEPA has done their own. It is well. That's my shout. Excuse me.
Mama, like maybe yeah, but no one work. Now all this like
Hello? Hello? Can you hear me?
All right, thank you for understanding. You won't believe what happened. They just decided to do one funny thing, but we are safe. It's fine. So please, sorry for that break. Are we together? Can I continue, please?
Yes.
Okay.
Yes, ma,
Just one.
continue.
Continue.
Sorry for that break. It happens sometimes. So we're talking about the signs of dehydration, and we had said that water is very important for us all to ensure that we adhere to it. Our patients, for ourselves, as we work, we should take water and ensure that So now, what can we do to ensure that some of the best practices is what we are trying to look at now? Best practices for maintaining hydration. Very important. Now, encourage regular fluid intake. That one, we cannot overemphasize it. What can we do about this hydration? Because dehydration kills very fast. I had already said that. You understand? So we have to encourage regular fluid intake, even for our children, for our family members, for our patients, then for ourselves too, as certified healthcare assistants. We should ensure that we take in fluid. Is very important. And two, our patients, like I said before we had that break, monitor their fluid. Monitor. Do you know how we monitor that? We are going to see it when we have the practicals. I said our practicals is packed. Now you'd see, especially for those that are using catheter, it's easier with those ones. And you check their fluid because it is recorded. The water they take in should align with the water they take out. Very important. So you have a way of monitoring. That's part of what you'll be trained to do, how to monitor their fluid balance, to monitor whether they are properly hydrated, to monitor the fluid that goes into them, and then what they send out. Because, you know, with illness and vulnerabilities, there are things that come with it. So if a person is drinking and is drinking less water and sending out that water, not the required quantity that should come out, it becomes a problem. You have to report. So you have to be on top of your game because you are checking everything. And what you are checking is the feedback that you give to the nurses that they actually would know how to help that person, or the care team will now build and work on. Adapt to individual needs. Every patient is not the same. That I already highlighted. So adapt to the patients depending on their needs. Work with them, help them to the extent with which they need this help. Do not take away their independence. That cannot be overemphasized. And above all, educate patients. Like I keep saying, that when you connect with a patient, when you connect with a person, you can easily get to that person. The person will easily give you a listening ear. The person will easily understand what you are actually doing. So when you educate these patients, the importance of water, you know, importance of them taking this water, it will not be a Herculean task for them. Anybody that knows the reason why he or she is actually taking something, to a large extent, the person will not pose as a challenge to you, because the person already knows that it's for his or her own good. Only in some situations that it happens, because it's not totally rolled out. So on that note, that is the A to Z of nutrition and hydration so far. It's primarily talking about how you need to ensure that you stay safe. You drink enough water, you take enough fluid into your system, as well as your patients as too, in this case. So that having said, I don't know if we have any question. I would just like to run down the last module for today, which is quite short, so that I can allow you rest, at least when it is 8. I wouldn't want to exceed 8 o'clock. Hence that. So if you have questions, please, like I keep saying, and I have been saying, the chat box is just there. Some of us may not really know how to use the chat box. Well, I don't know, because me, up until I started doing training, not everybody's computer like that, you know, 100% into computer. So even if you cannot use the chat box, please, okay, I've seen a comment in the chat box. Okay. Why are you not following, Kate? I've seen this particular model. I'm not following at all. Why? Do you have any issue? Maybe your network. Kate, can everybody hear me, please? Can everyone hear me?
Yes, I can hear you. Number one is network breakage, and secondly, my services was called until at work. So
Okay.
I didn't follow up at all.
All right. It's fine. There's no problem. You will get the slides. It talked about nutrition and hydration. So it's very easy. You will understand when you get the slides. So let's see how to beat time. So best practices for maintaining hydration is just the last slide before we go into what we have next. Now, the next module is medication management and administration. Medication, drugs, taking in drugs, that is medication. So as CHCAs, it's important we note this, because part of our duties it's one of our duties to manage medications for our patients. You oversee, you coordinate. How do they take the drugs in order to ensure that the outcome is, well, they get healthy, they get well at the end of the day. That is part of the thing you do. So what is medication management? Simply overseeing, like I already said, coordinating the use of medications. How and when should they take the medications? Very, very important. That is management. Then we have the administration, giving these medications to a patient in accordance with prescribed guidelines. So you have to be on top of your game because, of course, the medication is to help the patient. And if you are there to help the patients, it shouldn't come from you. You should do your own part of the work judiciously. Ensure that the drugs is taken at the right time. Ensure that you oversee. That is not only giving the drugs, you also check. Do checks. You understand, to find out if there's any reaction, if there's any drug reaction, you follow up the person and the drug as well. So that is medication, very simple. While administration, that's medication management. Then administration is the act, simple. There's just a difference. The act of actually giving this medication to a patient according to the guidelines, according to the prescribed guidelines of how the patient should take it. So why is it important? Why is it important for us to manage medication? One, for safety reasons. For safety reasons. To avoid error, to avoid reactions, to avoid interactions. So you have to make sure that you monitor, you manage that medication for your patients. Let the patient take the drug as at when due, take the right dose, a whole lot of things. Please, let's help ourselves, please. I don't know who is disturbing mommy. Fine. So we also have adherence too to ensure that it's very important that these patients take their medications as prescribed. We cannot overemphasize that, so that we don't have adverse effects. If they say take two tablets, it's 2 tablets. They say take at this time, you are monitoring it. The person is supposed to take at this time. Also important that we enable caregivers to observe. Excuse me, Infinix Hot 6, please help us to help you. I don't know how to say it again. Help us to help you. Just kindly mute. If you can hear, whoever is disturbing us, kindly mute. Thank you. So, adherence too. It's important that the patient takes their medications. They have to adhere. And you as the CHCA, you have to ensure that you adhere to the prescribed way of taking the drugs and the dosage. Monitoring also enables you to observe and report any side implications. Now, if you are to give a drug and a patient is actually under your care, it is important that you manage that patient and you understand how the patient should take the drugs, and you observe whether there's any side effect. You don't just take drugs and then leave the patient. Like I like to tell you, in Nigeria, anything happens. If someone just takes a drug, even you as a mother, you just give your child a drug, you don't stop to see whether your child has actually taken that. You observe to see if that child is fine. You even ask, are you okay? You check and you are sure there's no side effect before you not just take that drug. Have you taken your medication? Yes, and off you go. In our normal hustling, it's not very good. So it is important that we monitor in order to observe any side effect or any complications, not only in medications, even health as CACs, you are attached to people that maybe they just finished having surgery, or maybe they just finished one major procedure. You have to monitor. That is the essence. You are there. You are a healthcare. You are a member of the health team. You have to monitor, observe the person's moods, observe the breathing, observe a whole lot of things. That's why we will get to CPR. When we get to CPR, we talk about breathing. You'd see how very important your task is as a CHC. So these are the reasons why it is very important for us to manage medications given to our patients. Okay, we may have other ones that I would like, but for time purposes, maybe at the end, we are almost getting to the end. Now, as caregivers, what is your responsibility? Your responsibility is to do all those things that we have talked about. But then again, Will you just do it without actually knowing exactly what you are doing? For example, now a caregiver notices a client experiencing dizziness after taking a new medication. What are you supposed to do? Now I throw that question. Who is going to help us build a cart? That is an illustration. Maybe as a CHCA now, you observe, you notice a patient that is under your care experiencing dizziness. Maybe after taking the drug, you can observe dizziness on a person after taking a new medication. What should you do? What are you expected to do at that moment? Who is going to help us at least? Let me hear from you. Anybody, please?
Hello, everybody.
Yeah, okay. Who is helping us? Please write on.
As a caregiver, if you have a
And
patient that is experiencing after taking medication, the best thing for you is to inform the doctor the condition of the patient.
Thank you so very much for that beautiful answer.
Yes.
Inform the doctor. Good. The healthcare provider, that's very correct. That's the part that's the first part of it. Thank you for that beautiful response. So what's the second part of it? Because we have to do two things at that point. What is the second part? After you inform, that's you tell the doctor or you tell the nurse, what's the next thing to do? Please, who can help us complete the part B from that beautiful answer? Yes, anybody?
Please,
Madam,
please repeat the question, please.
Okay, the question goes like, I said that you are a CHCA, a caregiver in this experience. You observe or you notice that your patient, the patient assigned to you that you are looking after, experiences dizziness after taking a new medication. What are you expected to do as a certified healthcare assistant? Now, we've had the first answer, which is you should report to the doctor, inform the doctor. That's or the nurse, the person you should inform, the nurse or the doctor in this case. Then what's the part B? After the information, what are you supposed to do? What are you expected to do? That's
Hello,
the
ma.
part B. Yes, please.
Hello, ma. The first thing before are you hearing me?
Yes, I'm hearing you.
Hello. The first thing before informing the doctor that the patient is feeling dizziness after taking the medication, the first thing for the HCA is to check the vitals of the patient. After the vitals, you go to the doctor and report to him or her for the condition of the patient.
Okay, thank you. Thank you so very much. Very excellent answers, and I'm very wow. I must say I'm impressed to hear these answers. That's very good. Thank you for those responses. Any other one? There's still, we'll check the vital signs, we'll inform the doctor. Something else that we should do either before the information or after the information. Please, who is going to build the cart?
Can I talk?
Yes, please just tell us your name. So we would be, I'm trying to,
Okay.
You can talk.
Can you hear me, ma'am?
Right.
Yes, I can hear you.
Okay, it's Helen speaking, ma'am.
Okay, Helen, try.
Let me try. Okay, I think my own little understanding, at least for today's lectures, I think communicate with your client first, either your patient or client, as the case may be. Communicate, like you said, communication, as in communicating with your client,
patients,
very,
clients,
yes, very, very important and paramount. So I think the first thing is you communication in the sense that you ask the person how the person is feeling, how more like try to know try to know how and where the thing is, how the person is
feeling.
Yes, try to get that personal relationship and communication first. Then you now report back to either to the doctor or to the nurse or before you report the vital signs, before maybe you report to the doctor or the nurse.
Thank you
Please,
so
I
much.
don't know if I'm correct.
Thank you, Helen. Thank you. You see why what I said, that this thing it's just easy. Thank you so much, Helen. For that beautiful answer. Okay, Aminat, please, can you help us? I can see your hand is raised because we are almost done. So it's just time to discuss. Aminat, please go ahead.
Everyone hear me?
You sit or lie
Hello.
down, then take water.
Pardon, Aminat, you are not audible. I cannot hear you clearly, please.
I said, if
Okay.
such a person experienced what you said, the person should either sit or lie down, then take water.
Okay. Thank you, Aminat, for that. You see, I'm really learning a whole lot from you people here, from seasoned professionals. Thank you so much for that answer.
Okay.
Someone else wanted to, Kate, okay?
Yes, I think at this point, especially when the patient start feeling dizzy, and at first point we understand what dizziness is all about. It can make the first, at that point the person might feel like fainting. So it's the duty of the healthcare provider to healthcare assistant to be there. That is when the attention is needed more. You have to be there in order to protect that person either from falling or from getting injured at the moment. And then while attending to that, you put message. You need to check the vital signs to make sure that everything is okay. Then you send message or you get a in order to inform them about the present situation.
Wow, thank you so much, Kate. Thank you for that answer. Wow, beautiful answers. Thank you. Uchenna Juliet, please, your hand is up. I can see. Please go ahead. Thank you.
Another thing that I want to contribute to those answers that are be said by my colleague is that if there are people around the patient, you try to excuse them, make sure that the environment is clear so that the patient can be able to breathe. Sometimes the patient relative may be around, or so the area, the environment can be so busy. So you make sure that you clear the surrounding, the environment, the patient place. Thank you.
Wow, thank you, Juliet. You see, so in fact, your answers are wonderful, beautiful answers. Just one that I was trying to see if I was going to get the answer, but so far you have blown me off. That is, I know that this is just going to be a very simple, easy journey. We are just going to walk it all together because we are already grounded. Thank you so much. But one thing is still left. Just one little thing that may seem, well, one thing is still left. So do we have any other person to try? Madam Ugweze, I've actually not heard your voice today. Madam Ugweze, please, are you with us?
I'm available. I'm not feeling too well.
Okay. Wow. Oh, sad to hear that. Fine. But I know you will be fine. You are a strong person, so you just get up tomorrow. I know you you'll be fine, ma.
Amen.
Yes.
Amen.
Okay. Fine. So if we can go ahead so that we move. There's actually one last thing, and it's a very simple thing. As a CHCA, we should document anything. We should document. I'm not talking about inform. We should document. So the very first thing that we should do when you notice that with everything you have talked about, there are excellent answers. Give air, give space to the person so that maybe it's a want of air, that is making the person feel dizzy. Give space, check vital signs. Yeah, because the vital signs will be what they will do much later, but that's still very correct. If all your inputs are very correct, but as a certified healthcare assistant, though we've not reached that particular module, but we have reporting and documentation, maybe because we have not reached that, that's why it didn't really come to us. It is important that we document anything that happens. Write it, document it, sign it. Why? Because that particular act has cost a whole lot of people their jobs. Because if something just happens in the passing, yes, I understand when there is an emergency, people rush to do what they have to do. Yes, which is right. By the time that particular situation is handled, ensure that you document. You document it. Very, very important. So that you'd have a proof. Anything you don't document, you did not do. That's just the fact. So you can say, oh, when it happened, I actually went and reported to and the person says, and maybe at the end of the day, it actually goes very bad. The person says, no, I was not told. You did not tell me. It happens, especially if it's a very good friend of yours. Let me be ironic in this and now. Maybe a very good friend of yours that's really, really loves you, and you reported, then something went wrong. He's trying to see how to push the blame on you. You have done your bit because you've documented and there is an evidence. Anything that is not documented, there is no evidence, but all your answers are perfect and very, very great. So we just have 10 minutes to go. So good. So now, if you have a patient, again, I want to ask one question before this is the last slide, so we'll be done before 8, like I said. I want to ask another question. If you as a CHCA, now you have a patient that refuses to adhere to their medication routine, let me say that's as prescribed. You have a patient. What strategies, what can you do to ensure that your patient adheres to their medication regimens, maybe routine? What can you do to ensure? Because it is actually a challenge. What can you do? Maybe I don't want to take my drugs. No, I don't want it now, and this and that and that. So what are you supposed to do? Yes, Uchenna, Juliet, I can see your hand raised. Please write on.
One of the things that we do is to
Please, Juliet, are you okay? Go ahead.
Yes, is to communicate with the patient. Try to know what the patient like. Try to see what can ease him, or her. Sometimes because of the frustration or because they feel they are supposed to do this thing by themselves. You are the one helping them. They may be aggressive. But if it's somebody that like a relative around, can bring their relative. If it's somebody that likes story, you can say, you can tell them stories, just to ease that anger and make the person happy.
Wow, thank
you. So doing, the person will be able to take the drugs.
Wow, Juliet, that's a beautiful, very beautiful response. Thank you so much for that. So practically, everything boils down to communication. That's just it. See, even me, as I'm sitting here talking to all of you on the platform, if I can live with someone that is mental, I can live. Is that, I'm telling you the importance of communication. So long as you know what that person likes and what the person does not like, you have the key to unlocking. That's the key to making yourself happy. Sometimes we get ourselves maybe trying to do something, for someone, and we get pissed off at the end of the day. Of course, as caregivers, you don't need to be pissed off because you've already signed. You've already signed to do that humanitarian work. And so nothing should piss you off. But there are times you just get fed up. It happens. I must prepare your minds. You just get fed up, like tired, and you just feel bad at something like that. Oh, you're trying to help someone and the person is constituting a nuisance and all these things, and you just go just blow your top like that. No, it doesn't work. So with everything, if we can communicate, the communication is a two-way thing. It makes you happy. It makes you happy. And most of caregivers that have actually relocated, that's the beauty of this training. At the end of the day, you belong to that community. You get to see people that are actually in the jobs, in the field of this work. And they tell you it's not rosy. They tell you it's not easy. But if you have made up your mind, that's why I tell anybody, if you know you are highly temperamental, you are not patient by nature, please, you get to another profession would be better. Because with this particular profession, as you walk into it, whether you are a paid one or you are the one that is a family caregiver or anything that you are doing as regards in the line of caregiving, you have to turn your name to patients. That's just it. You have to turn your name, you attach patients to your name. Because, of course, there are times you really get there. We talked about caregivers burnout. There are times you have that burnout, like you want to give up or you'll be frustrated. We've seen situations whereby racist countries, if you work with racist people that because you are black, they are white, that alone will make them to start misbehaving and all this. So a whole lot of things comes into play when we talk about healthcare work. It comes into play. But the beauty is that everybody we have trained from BCC UK have always come back. We've not had any negative outcome or negative feedback. So I trust that as seasoned as you are already, that I can see, I trust that everybody will actually create an impact in this field that they are entering. So practically, that is it. So understanding medications, that's another thing. It's very important that we understand these medications. We know what to do. Very important. We know what to do, the right dosage, understanding, know the purpose, the dosage, and the side effects of medications. You may not be the doctor, you may not be the nurse, but you are very, very critical, let's say, very important member of the healthcare team. So even as your patient is taking drugs, you should have an idea of what that drugs is, what it is going to do, how is the body going to work after taking that drugs. That's why we looked at the surface of anatomy and physiology, how the different systems in the body and organs, what they can practically do. At least have that at the back of your mind. You would look at professional advancements in one of the modules, so you can see that you would see that you can learn a whole lot. You can do a lot of trainings. You can keep yourself abreast with, grow higher, move forward in the field. So we have 5 rights of medication and medication administration. Very important, this particular point. There are 5. The right patients, you must, before you attempt to give anybody drugs, it must be labeled. You must know that this drug is for Peter. For instance, this drug is for Peter. And the right medication as well. This drug is actually for Peter. And then, is it the right drug for Peter? Or is this drug meant for Peter? Is it the right drug? Is this what he's supposed to be taking at this time? Okay, am I to give him, is he supposed to take a teaspoon, or is he supposed to take 2 tablets? You must know the right dose. Then the right route, whichever one. How is the person taking it? There are drugs you take in your mouth. There are oral drugs. There are drugs you take through intravenous, that you take through your veins. There are drugs you take, like for women, there are sometimes for certain medications, they give you some form of drugs that you have to insert into your body. You know, there are a whole lot of ways. There are different routes that drugs can be taken. So, and is this drug being given at the right time? Those are the 5 rights of medication administration. It does not run away from professional exams, health professional exams, be it CNA, be it caregiving, be it CACA. They always, I'm giving you ESPO now, what we used to call ESPO in those days. ESPO now. There is no way you run away from this right of medication administration, because we've had issues. This has created a problem. We've had issues whereby drugs are interchanged. Oh, healthcare workers make mistakes. The drugs they should give to Peter, they are giving it to Titus. You know, at the end of the day, it's bringing a whole lot of, just because of carelessness. So these rights are very important. Before you attempt to do anything that has got to do with drugs, you must check the label. Even when you are not there, you are handing over to another person. Make sure that the drug is labeled, the containers are labeled, so that anybody that is taking over from you, if you work in shifts, will actually know that this drug is for this person, and this is the dose and every information, and at the right time as well. So that having said, I think we have wrapped it up. This is the end of today's training. I don't know if we have any questions or we have any contributions. I told you I will not exceed 8 o'clock, so that we can all go and rest and prepare for yet another interesting session tomorrow. So do we have any question, or do we have anything we want to contribute? Yes, that reminds me that just reminds me something before I forget. I was talking about mistakes. Even in the labs, the lab attendants too also make that mistake, you know, and it has cost people's life. There are times someone will go for a test and they'll not do it. They'll do the test, but they'll give the result of A to B. And at the end of the day, it causes emotional trauma. It causes a whole lot. So on that note, this particular 5 rights is very important. It's stress for anything you do in the health sector. You must have it at the back of your mind that you have to be careful with these things. So on that note, thank you so very much for the patience. If you don't have any question, Before we wrap it up, I want to just one person to tell us one thing that he or she took home today. Just one person. And then we wrap it up, because I will not wrap up with me doing the talking all alone. I want to hear at least one person's voice so that I can go and get ready for tomorrow's session. So we've come to the end of today's training. Who would help us? What have you learned? Just one sentence in any of the modules. We will not take time so that we don't exceed 8 o'clock African time. So who is helping us to say something? What have you learned? Maybe something you already knew before and you just reminded yourself in this training.
Hello.
Yes, please. Yes, please. Go ahead.
Okay.
Tell us. Tell me.
Documentation is very important. Communication as well is very important. Communicating with your friend, knowing their mood, knowing what they like, and it them, and it helps. It also helps you to help them become better.
Okay, he's Helen speaking, ma.
Thank you. Thank you so much. Thank you. And thank you so much. I think that was Osareme. Network is beginning to be funny. Thank God we have finished. Thank you so much, Osareme, for that response. I'm glad that I know with time, if we had enough time, everybody would have also said what they learned. But I want us to go back and rest. So tomorrow we have yet another day. I want to say a very big thank you to everyone. Those that have not responded, tomorrow we'll start early so that they will tell me, at least 5 people will tell me what they learned today, adding to what Osareme told us today. On that note, we want to say a very big thank you. Do have a lovely night rest as I hand over to Andy Smart Solutions. Thank you.
Thank you very much, ma.
You're welcome.
Thank you so much, Doctor. Thank you so much. It has been a wonderful, and as normal, you delivered. I want to appreciate participants for taking time out to engage in this lesson today. Do have a lovely night rest. We'll meet again tomorrow. Good night, everyone.
Good night. Bye-bye.
Bye.
Thank you.
Thank you. Good night.
Good night.
Bye-bye. Thank you. Thank you. Good night, ma.
Yes.